Hi, everyone. Good afternoon and welcome to SCAN's Lunch and Learn. For those of you joining us for the first time, SCAN stands for Senior Citizens Activities Network. We're a nonprofit serving the Monmouth and Ocean County community since 1988, keeping the senior community active, healthy, and connected. I'd also like to acknowledge that May is Older Americans Month. It's Healthy Eye Vision Month. It's Healthy Hearing Month. We just had a SCAN FYI this week with a ophthalmologist, and next week we have a audiologist with us. So again, stay tuned to our SCAN FYIs. They're on our YouTube channel or catch it on Facebook on Wednesday mornings at 9 a.m. So this afternoon we have two wonderful presentations. I love all our presentations, but I don't know, for some reason, I'm very excited about the two we have today. So first, we have Dr. Kathleen Carpio with us today. So I'll invite Dr. Carpio to join me on camera.
Oh, hi, how is everybody doing?
Oh, so I want to acknowledge that Dr. Carpio is coming with to us from Robert Wood Johnson Health Group, Monmouth Medical Center. So thank you for always being a sponsor and very supportive of our SCAN and our mission. So thank you for being with us today.
Oh yeah, it's not a problem.
Okay, I'm gonna give the screen all to you. Okay.
All right, so once again, hi, I'm Kathleen Carpio. I'm a family medicine physician from Robert Wood Johnson Barnabas Health Medical Group. And today I'm gonna talk to you about the top 10 things that I feel that people need to pay attention to as they age. So I based this list off the healthcare trends I noticed in my patients over the years. All right, so now I'm gonna turn off my camera and share my screen with you. All right, so one of the symptoms that's most concerning as you get older is chest pain. Various problems can cause it. It could be a spasm of the esophagus from acid reflux, anxiety, inflammation of the chest wall due to a virus, or even muscle strain. The most worrisome, though, is that it could be a manifestation of a heart attack. For females, early heart disease is considered happening at less than 55 years old. Meanwhile, for men, early heart disease is classified as occurring at less than 65 years old. Having a family history of early heart disease increases your risk of having a cardiovascular event. Your doctor can properly estimate your 10-year risk of heart disease or stroke around the age of 40 to 75 if you're ever concerned. Women, diabetics, and people more than 75 years old may experience an atypical presentation of a heart attack where there is no chest pain. Symptoms in this scenario could include abdominal pain, shortness of breath, dizziness, palpitations, sudden diffuse sweating, a fainting spell, and jaw, neck, back, or abdominal pain. If chest pain ever lasts more than 15 minutes, is severe, different in character, or associated with other symptoms such as nausea, vomiting, and numbness, consider going to the ER. At the age of 65, it's recommended that people get screened for their risk of falling. Think about whether the last fall you had was just accidental, like due to a slip, or if there were other symptoms going on at the time. Have you had multiple falls in the last 3 months for unknown reasons? Your doctor can order blood work and do a physical exam to help you investigate possible causes of the fall if you believe it wasn't just due to mechanical error. Physical exam might reveal the source of your issue to be the occurrence of a significant change in your blood pressure or heart rate as you move from a flat to upright position. The culprit may even be joint pain. Your doctor can assess if your joint pain is leading to weakness or episodes of giving way and determine if you would benefit from physical therapy to prevent future falls. Changes in vision can also impact your ability to successfully navigate your way around your home. During your medical intake, your doctor may discover other health issues increasing your risk of fall, such as dehydration, a medication side effect, or nerve damage from nutritional deficiency, excessive alcohol use, or diabetes. It's important to gauge how severe these falls have been. Depending on how much it's interfering with your daily life, your PCP may feel that you might benefit from an ambulatory assistive device like a cane or rolling walker to prevent future falls. Breaking your bone from a standing height may suggest you have osteoporosis. Your doctor may order a DEXA scan to assess your bone density to confirm the suspicion. If it's detected, you may need medication and a referral to physical therapy to learn proper weight-bearing exercises to help increase bone density. Polypharmacy is the use of more than 4 medications on a regular basis. Some medications are eliminated through the kidney. As you age, the kidney doesn't function as well as it used to, so there's a higher chance that the medication you normally take might lead to a side effect since there's more of it present in your body at a single time point than when you were younger. You can be more susceptible to side effects like dizziness with the use of medications like muscle relaxers and anticholinergic medications used for overactive bladder, dizziness, and depression. Consider making an appointment with your doctor to see if you can reduce the dose or be taken off any of your medications if you feel like you're on too many. Memory loss is another concern that preoccupies people's minds, especially around the age of 50. One clue that it might be time to see your PCP is if friends and family are starting to become concerned about your memory problems. Forgetting things, but being able to recall them after a hint and occasionally misplacing household items are considered part of the normal age-related forgetfulness. This occurs due to gradual structural changes occurring in the brain as you age. Memory loss becomes concerning if it's interfering with your daily life. For example, it's alarming if you forget how to do daily tasks like driving a car, seem to be frequently losing things, or forget the names of the people close to you. Your PCP can do a basic screening test to assess your memory and trend it annually to see if there's a cognitive decline occurring that's concerning for dementia. Blood work to check for infection, thyroid issues, metabolic imbalances, and nutritional deficiencies may be warranted if there's a strong suspicion. An MRI might even be ordered if there's concern for the presence of a tumor, recent stroke, or other structural brain changes that could induce seizures. It's possible that anxiety or depression might be manifesting as memory disturbance. Thus, you might get referred to a neuropsychologist to take a test to determine whether or not your periods of memory loss are actually due to cognitive issues. Stay on top of how badly your forgetfulness is. Catching the issue early can help reverse the problem or at least get you access to medication that can help slow your cognitive decline if it's related to dementia.
Dr. Carpio, it's Mary Beth. I just wanted to interrupt. I failed to tell everyone that the chat feature is available if anyone has questions that they would like to ask the doctor at the end of the presentation. Thank you.
All right. So adults over the age of 50 tend to develop urinary issues, including urinary incontinence and nighttime urination. The very first thing that needs to be ruled out is a urinary tract infection, especially for women. For men, an enlarged prostate might be placing pressure on one part of the urinary tract, leading to a disruption of the flow of urine. Meanwhile, for women, Besides a UTI, the physical stress on the pelvis from a natural childbirth and the hormonal changes related to pregnancy or menopause may weaken the pelvic floor muscles, ultimately leading to urinary issues. Depending on how badly your urinary changes are impacting your quality of life, you might benefit from surgery or a medication to help control your symptoms. As you become exposed to more UV light during your life, you may notice the development of new skin lesions. It's possible that one of them could put you at a higher risk for skin cancer. Some concerning characteristics for a lesion include large diameter, irregular borders, multiple colors, a raised appearance, or an evolving nature in terms of color, shape, and size. If you ever notice any of these characteristics on a skin lesion, see your PCP or dermatologist to determine if the lesions are precancerous and can be destroyed with liquid nitrogen. If the lesion is suspicious for cancer, a skin biopsy may be needed. Due to various medical problems that you may develop as you get older, there's a possibility you may not be able to walk around as much as you used to. It's important to avoid staying in the same position for an extended period of time, since this might lead to the development of bed sores. Risk factors include limited mobility, nerve damage, poor circulation, and malnutrition. If you ever spot any bed sores, your PCP may be able to refer you to a wound care specialist who can help speed up the healing process. Due to structural changes in the inner ear that take place around the age of 65, the ability to hear high-pitched sounds gets worse. Around half of adults have this issue by the age of 75. If you happen to notice a gradual decrease in your hearing that's not improving, consider going to your doctor. The problem might just be that there's wax blocking the opening of the outer ear canal. This wax can be flushed out with a special solution during an ear lavage performed by an ENT or PCP. Hearing loss could also be due to fluid buildup in your ear related to allergies or a virus. People with TMJ problems may have inflammation going on that's leading to blockage of the eustachian tube of the ear and thus the sensation of plugged ears or hearing loss. Upon physical exam, your doctor may end up discovering a dental infection was reducing your hearing by decreasing blood flow to the ear. Starting around your late 40s, remember that if you ever experience sudden hearing loss that gets worse over 3 days to the point that regular talk sounds like a whisper, go to the doctor immediately to get evaluated. The hearing loss may be stemming from an issue with the nerve of your ear. The condition can be effectively treated with steroids if started within the first 2 weeks of symptom onset. Depending on the severity, hearing loss in general can limit opportunities to socialize, lead to missed appointments, and cause problems with hearing important alarms such as a car horn. Some causes of it are reversible, so it would be wise to get your ears checked out if you notice any change. People after the age of 50 might develop issues with the functioning of the valves of their leg veins. As a result, blood may pool in the veins of the legs, leak into the surrounding tissue, and ultimately lead to swelling and skin discoloration. This health condition is called chronic venous insufficiency, and it may be associated with symptoms like leg cramps, itching, and numbness. A couple of risk factors for this condition include obesity, sedentary behavior, and prolonged sitting or standing. One of the first concerns that comes to mind when seeing this skin discoloration and swelling is a skin infection or blood clot. However, this is unlikely if the skin changes are on both legs and there are no other risk factors. Your doctor can do blood work to help rule out other causes of swelling, such as organ failure, anemia, and malnutrition. A review of your home medication list may reveal a medication that is causing swelling as a side effect. A physical exam might suggest that the cause of leg cramps and skin discoloration is due to peripheral arterial disease, which is a disease that occurs after the age of 50 that is caused by plaque buildup in the blood vessels of your legs. It has been reported that about 50% of people are asymptomatic. Possible symptoms that can emerge include leg cramps, leg pain, leg hair loss, a weak pulse, and skin discoloration. If not recognized and treated appropriately, the decrease in blood flow to the legs as a result of the narrowing of blood vessels might make you more prone to ulcers and poor wound healing of the lower extremities. The presence and extent of this condition can be confirmed with a test called an arterial Doppler ultrasound of the lower extremities. Once confirmed, medication can be used to help control symptoms and reduce the buildup of plaque. Severe occlusion of the arteries may require surgical intervention to help improve blood flow. Depending on the underlying cause of leg cramps and age-related skin changes like swelling and skin discoloration, your PCP can design a suitable treatment plan, which may just include periodic leg elevation and the use of elastic compression stockings to help promote blood flow back to the heart. Around the age of 40, the lens of your eye starts to become less flexible due to a phenomenon called presbyopia. As a result, issues with adjusting focus from a distant point to a near point becomes more difficult and it becomes harder to read. This loss of flexibility gradually gets worse until about the age of 65. Poor vision can precipitate headaches and dizziness. So if you notice any of these problems with your vision, consider going to an optometrist or eye doctor to see if you need new prescription glasses. Around the age of 40 to 50, the protein in the lens of your eye starts breaking down, and this results in deposits in the lens of your eye that gradually starts to cloud the lenses of your eyes. This clouding of the lens is called a cataract. As cataracts become more dense, your night vision is affected. You might see a glare, starbursts, or halos around streetlights. There might be trouble distinguishing between different shades of a color, especially with dim lights. People who are farsighted might notice an improvement in their ability to see close objects during the early stages of cataracts. This phenomenon, which is called second sight, is just temporary though. Ultimately, both distant and near vision become worse in the late stage of cataract development. If you start noticing these problems, consider going to an ophthalmologist to get your eyes examined and see if you're a candidate for cataract surgery. After the age of 65, the muscles used for swallowing get weaker. Other parts of the swallowing process experience changes as well. This can lead to trouble swallowing, which is called dysphagia. Dysphagia can cause episodes of choking and coughing if food goes down the wrong pipe. This type of problem increases the risk for bacteria containing food and liquids entering your lungs and precipitating aspiration pneumonia. Depending on the severity, it may even lead to malnutrition and unintended weight loss. Other issues that can cause trouble swallowing include uncontrolled acid reflux, a stroke, a neurological disorder like dementia or Parkinson's disease, a tumor in the esophagus or mouth, and a yeast infection of the esophagus called thrush. Perhaps even biomechanical changes in the process of breathing due to uncontrolled lung disease like COPD might disrupt the coordination of breathing and swallowing, leading to dysphagia. Due to there being various possibilities for the source of swallowing issues, it's important that you go to your doctor to get examined. Early detection and treatment can help prevent this problem from getting worse. All right, so now that you're more informed about the various changes that can occur due to aging, remember that every person has a unique case because they have different health problems and are on different medications. If you notice that you have any of the problems we discussed, make an appointment with your doctor so he or she can properly evaluate you. If you have no primary care doctor, you're welcome to establish with me at Neptune Primary Care Clinic. I'd be happy to help you with your medical problems and create an individualized plan with you to help you achieve your health goals. Same-day appointments and telehealth services are available. Does anybody have any questions?
We do have some questions, Doctor. Could you comment on the use of pelvic floor therapy for urinary changes? Could you hear that
hello?
question?
Yeah.
Could you hear that question? Could you comment on the use of pelvic floor therapy for urinary changes?
Well, for the use of pelvic floor therapy, well, it depends on how severe the condition is. Like if at first, if it's like a mild condition, the first thing people usually recommend is Kegel exercises. And there's a pelvic floor physical therapist that can help you. And sometimes if for some reason that this doesn't work, then sometimes you might need to go to like a urologist or even maybe like a UroGYN to get their opinion, because then there are some various surgical interventions that can be done.
Okay. We have another question that came in that was asking, is it best to call 911 and wait for an EMT/ambulance, or if you know you can get to the hospital quicker on your own, is that the best option?
Are you saying general or are you talking about the one for the ear?
I'm sorry, I think they're asking if you're experiencing chest pain.
Oh, for chest pain.
Yes.
Well, yeah, if it's pretty obvious, like if you were just having, for example, like this abdominal pain and that's it, that's one of the atypical symptoms. But if you're having more of the other symptoms I discussed, like if you're having like the classical chest pain, or you're having this sweating that came out of nowhere, if you're having like 2 or 3 more symptoms, it might be a good idea to go to the ER directly or call 911. But if you just have one symptom that's atypical, or if you just have this chest pain and it doesn't feel very severe, then you can always feel free to call like your primary care doctor. We always have like there's always a doctor on call in the weekends, and they'll give you an opinion maybe like within 15 minutes on whether you should go to the ER.
Okay. I think the question might be directed more towards, if it's, let's say it's a severe situation, are you better off putting yourself at risk, maybe potentially putting yourself in the car to drive to the hospital, or are you better to wait for 911, call 911 for an EMT, knowing that they, I guess, have the equipment that they.
If you know it's pretty severe, then I wouldn't recommend you having like a severe abdominal pain or something, or severe chest pain, because you don't know, maybe you're going to end up fainting. That'll be kind of dangerous for everybody on the road, including you. Right. But if it's like a little minor thing, it wouldn't hurt to get a second opinion over the phone.
Okay. And then what diagnostic testing is typically performed to diagnose dysphagia?
Well, for dysphagia, usually the first thing you usually do, at least in my practice, or what I've learned in my training, is the first thing they usually assume is that it might be like an acid reflux, but you have to clarify with them whether when you feel this dysphagia, is it more in the upper the upper part of the neck, upper throat, or is it more in the lower half of the throat, chest? Because if you tell them it's in the upper part of the throat, when you say you're having these choking episodes, then they might order something called a video fluoroscopic swallow study. And then they give you some barium, and they'll see what types of foods you can tolerate. Because maybe it's just that your swallowing muscles aren't able to tolerate certain types of foods anymore. They have to adjust your diet. They give you like some sort of like a pureed foods and stuff.
Okay.
And then there's also swallow therapy as well, if that's the case. But if it's more from the lower part of the throat and chest, when you feel it, the little discomfort, then most likely your PCP will give you something like a omeprazole, which is Prilosec. And then they titrate it up. And then if you reach the maximum dose, like it's 40 milligrams twice a day, then they'll most likely refer you to a gastroenterologist to get a scope, and they'll try to see what's going on. Maybe you have like some complications of acid reflux or something, and you might benefit from some sort of a procedure.
Okay, great. And we have a question: are taste and smell affected as we're aging?
Well, yeah, some people say that your taste is affected a little bit when you're aging. Yeah, there's sometimes stuff happens to the taste buds. For smell, I haven't really heard too much complaints in my patients at all over the years. Nothing too significant.
Okay, good. And finally, any key exercises that you might recommend to help fight off the osteoporosis?
Well, for osteoporosis, it all really depends on how severe the osteoporosis is. And then also, if you feel like you're the type of person who usually tends to get into accidents, So if your osteoporosis isn't that severe, you might try some high intensity weight-bearing exercises, would be like jogging or doing some heavy garden work. But in these types of activities, there's always a chance you might get into like some accident, you might fall down. And then if you have this severe osteoporosis, then if you end up falling down, you might break a hip or something. Right. So if you feel like you're that type of person that might get into this type of trouble, then maybe you might want to tone it down a notch. Maybe do some moderate intensity exercises. Some moderate intensity exercises would be like practicing climbing the stairs, maybe even dancing a little bit with your significant other or just alone in the room. But if you have severe osteoporosis, and that would be like if you have a T-score in the DEXA scan of -3.0 or greater, or you have like a history of like a recent fracture from like a standing position, then you might want to try something that's more safer, like doing maybe swimming, walking, yoga, or even try using maybe like the elliptical machine, because then you're holding on to something and it's less likely that you'll fall down.
Right. Yeah, swimming's one of the best exercises, is it not, doctor?
Yeah. And then also, when you try to do these exercises, try to always aim for doing like 30 minutes of exercise, like 5 days per week. All cardiologists recommend that. It's good for the heart and everything.
That's awesome. Very good. Well, thank you so very much for joining us today. And again, this is being recorded, so we can always come back and reference this for future viewing. So thank you so much for being with us today, doctor.
Oh, it's my pleasure. All right. Thanks.
Okay, so you can stop your screen share, and I will invite Jennifer from Horizon Blue Cross Blue Shield to join us.
Hello.
Hi, Jennifer. How are you?
I'm well. Thank you so much for having me.
So you have your Braven logo going today.
I do.
Wonderful.
And that background is reflective of the weather outside.
Oh, it's a beautiful day today. So again, we'd like to thank Horizon Blue Cross Blue Shield of New Jersey for being another wonderful sponsor of SCAN. So Jennifer, do you have your presentation, or you need me to put it up for you?
I think I'm able to share this.
Okay. If not, I'm here. So go ahead.
So you tell me what you're seeing.
It's
then
you're good.
Yep. Okay. I do have a version on my end that has some notes. So you tell me if you see those, and then I'll make a modification.
No, we don't see the notes. You're perfect.
Okay. So after listening to that doctor's presentation, I know what I walk away with is that there's so much that goes into putting the pieces together in the puzzle. So much goes into making a diagnosis or coming up with an individual care plan. And with that being said, I can't emphasize enough that it's up to us to get the most out of our doctor's visits, whether it's telehealth or in person. So the best thing that we can do as patients is to be prepared to inform our doctors of everything that's going on. And we'll talk more about that as we advance here. So let's go to my next slide. I'm not sure I can do this. Did that change for you all?
Yes.
Okay. So first and foremost, before the visit, and we'll talk in a little bit about what type of visit you're going to be having, whether it's a routine visit or a follow-up visit based on previous symptoms or more of an emergency visit. But before any visit, you should write down any questions or concerns that you have for the doctor, including any changes since your last visit. During the visit, that would be your opportunity to ask your questions and report any of your changes or concerns. And while the doctor is giving you their recommendations or some guidance, of course, what I would suggest is, in addition to the questions you've written down, take notes so that after the visit, it will be up to you to follow the instructions. And sometimes we can get, nervous or frustrated, and we're trying to rush as to not take up too much of the doctor's time or our own time, and we could forget things. So if we're writing them down, this way, when you leave, you can review what you went over, and you can always call and follow up with the doctor's office with any questions that you might have had or forgot to ask. And if they're written down, that will help. There are 3 types of appointments, which I touched on a few moments ago. There's a regularly scheduled appointment, and those are based on a conversation that you and your doctor would have on the frequency that you need to be seen. Whether your appointment is associated with blood work you need to have, and then you follow up with that regular appointment. There's other appointments that would come along with not feeling so well, or any changes that you might be encountering and are concerned about. And those would be associated with any symptoms, and you would, of course, call the doctor to make an appointment for that. If you are feeling sick or under the weather and it requires immediate attention, you obviously, as we talked about at the end of the doctor's presentation, would have called 911 if you were in distress. But if it could wait to talk to a doctor, then you would call and make what's called a sick or emergent care appointment. And we also have the capability of getting ourselves to walk-ins or urgent cares if we weren't able to get ourselves in with a doctor in a timely fashion. So when you get to the appointment, there's a couple of things you should have with you. And first or foremost, a family member or a friend is always helpful. And we refer to this as the buddy system. If not even just for a ride, which is, I know, super helpful, you can have someone that's there to take away or alleviate that stress of parking or being punctual. Having a family member or friend with you is sometimes added support during an exam. They might help you remember questions or answers to the questions you got if you didn't write them down. Another super important thing to have with you is your health plan ID cards. Your health plan ID cards helps the doctor's staff look up what coverage and benefits you have, as well as what copays there might be. They can usually tell you if you need referrals, if the doctor is referring you to a specialist. So having your ID and your health plan ID cards is always very important. A list of your medications. I can't emphasize this enough because, as we heard from the doctor's presentation, sometimes symptoms that we're exhibiting could come from a medication that we're taking or not taking correctly. And that's why if you have a list of your medications with you and that includes the dose and the frequency of how often you're taking it or supposed to be taking it. That's super helpful for a doctor. Even if it's not a medication that the doctor you're seeing prescribes, don't think that it's not important to mention, because it could contribute to the reason you're there. Sometimes there are side effects from medications that we're not aware of. And even if we read the pamphlets from the pharmacy, it's best to have your doctor know what you're taking. And speaking of pharmacies, that's another important thing to remember to mention to your doctor, because they may change medications or need to call in a medication for you. And your most current pharmacy is very helpful for your doctor to have. A list of doctors and specialists is super important too. This really helps coordinate the continuity of your care, because doctors will message each other or phone call each other to discuss maybe a medication change or something that you're presenting with at one visit, which another specialist should know about, and so on. And of course, bring your calendar with you, whether you keep it in a device or have a paper calendar. Either way, when you and the doctor are discussing whether it's lab work that needs to be done or a next follow-up appointment, knowing your calendar really helps with coordinating when your next visit should be. So while you're at the office or doing a telehealth, which I think we've all now encountered at least one during these times, there's important things you should keep in mind. And I spoke about this when I said bring your buddy with you so that you are not feeling rushed or stressed. Don't rush through the appointment. You or your doctor and should just, this is how you'll alleviate forgetting things or forgetting something they said to you, forgetting to ask a question. Have a conversation and state the reason for your visit. Give as much details, even if you think they're silly details or unrelated. Any change, we know ourselves best. So any change that we're exhibiting is important to a doctor to know. We might not think of this little bit of weight loss or gain means anything. It could be significant into the symptoms you're exhibiting, and the doctor will be the one to help you put that together. Next, share your symptoms and describe how you're feeling. And again, we're back to letting the doctor know what medications you're on and why you're taking them. Ask your doctor to explain the treatment plan. If there's something the doctor's recommending or prescribing, if you don't understand why, please ask. They are more than happy to explain and would rather you leave informed than leaving with questions. And to speak to that, the next bullet point says, don't hold back on any questions. Make sure you understand your doctor and all your questions are answered. Next slide. So talking to your doctor. This is important because you should understand what's going on and what you're discussing. You should know when and why your doctor should be called. I think that was one of the questions someone asked about in the chat, knowing the difference as to when to call your doctor or when to call an EMT or an ambulance. When you are at a doctor's office, make sure if anything new has been prescribed, you get a copy of the prescription. And if any labs have been ordered, you leave with the prescription for that, as well as any test results that you may have gone over with the doctor, because they may be instructing you to go to a specialist, and it alleviates some time if you have the report or labs with you when you go to your next appointment. And you should plan your follow-up appointment with the doctor before leaving the office. And that's why it helps to have our calendars with us. Ask for referrals if you need them, and anyone on the office staff can help you determine that if you yourself don't know what your benefits entitle you to as far as needing referrals to see specialists or other doctors. And if there's new medications, the pharmacies are very good about providing information with regard to possible side effects or adverse effects, but feel free to ask your doctor at this forum, at this visit about that. And that's, again, just making the most of your appointment and your time with your doctor. So telling the doctor exactly how you're feeling. I can't emphasize that enough. The doctor needs to know your symptoms in order to prescribe and treat you best. And even if things seem minor or unrelated, I'd leave that up to the expert, which would be our doctor, to determine and make that analysis for us. When your appointment's over, you will make sure you understand the doctor's care plan and instructions. You will make sure you schedule, like I said, any appointment that's due, whether it's with the same doctor as a follow-up or with a specialist. You will plan for your follow-up visit or a special visit, and you will update your records. And you will let your family or your buddy, friend, whoever you went with to that appointment, if that warranted, know of the new appointment time. That takes some pressure off of us. Someone else knows. Now we've spoken it out loud to someone, and they will help remind us. Check for new symptoms. This is super important. If a doctor prescribes you new medication, especially, if you feel different within the first few days or few weeks of starting a new regimen, make sure that you communicate that and don't necessarily wait for the next appointment to do so. Office staff at a doctor's office would be more than happy to relay to the doctor any kind of differences you are experiencing since your last visit. And I will emphasize one more time before we take questions that don't wait until your next appointment. If you have questions or concerns, open communication should continue, not just during the appointment. This is your doctor's visit, so never be afraid or ashamed to ask or discuss anything. And I will ask Mary Beth to read to me what's in the chat if there are things that either are for me or the doctor to answer at this point.
Jen, would you mind just stopping your screen share? And I'm just going to ask you to come on camera with me. And I think Dr. Carpio is still on the webinar with us. And if she is, I'd love to hear if she has any comments from her end of that conversation as a physician when her patients come to her. So we'll see if she's able to join us. But I do have a couple comments. SCAN offers diabetes self-management and take control of your health workshops. And we're always stressing communication with your healthcare provider is so important. And especially when you're prescribed a new medication and maybe you're not going to take it, be honest with the doctor and tell them I'm not going to take this medication because you're not helping yourself.
I've heard it all. They really have. So
they probably can read the body language when they were like, I can tell somebody's hesitant about that recommendation, right? And you talked about the medication list and keeping that updated, and mark on the date at the top, like updated as of a certain date. So when you've last kept that medication list current is very important. I'm trying to think if there's anything else that came through. Again, don't feel rushed. you know, everyone always feels like they're under the gun, right, in their office visit to make sure that they're covering everything. So I think your points were very valid today. And I guess Dr. Carpio, she's showing that she's on here, but maybe she actually didn't completely exit the webinar. But again, if anyone has any other questions they want to ask Jennifer, feel free to put it in the chat. But I will thank you, Jennifer, for a great presentation. Always good to hear all the things we should be prepared. Oh, I know what I was thinking. Technology, you know, use technology to your advantage when you go to your appointments. If you can't have a friend or a family member be with you, perhaps maybe ask the doctor, can I get, you know, my son or daughter on FaceTime? They can be there with you. I guess especially during the pandemic, right? You were limited sometimes to who you could bring into the office visit with you.
Sure, we might be limited to not having anyone come with us, but
Right, exactly.
Absolutely then.
Exactly.
That's a great point.
And what's the trend been with the telehealth visits overall? Has there been a spike with people utilizing the telehealth visits?
I think probably more so with primary care providers, yes. Specialists, I can't speak to, but yes, especially we're a little more advanced now than we were a year ago.
Right.
But a year ago, absolutely, in that we were all so heavily relying on, you know, social distancing, and doctors' offices were limited to, I think, more sick visits than well visits or routine visits.
Right.
And they would encourage us, if we were feeling well, but just following up, to do so through telehealth as
Right.
opposed to coming in.
Right.
Not so much now, maybe.
And it's a great tool that we all, you know, hopefully now know how to utilize. So that's
I wasn't doing this a year ago. So
right. Exactly. Well, thank you so much, Jennifer, for being with us today. I hope everyone got lots of great information. Again, this is being recorded. It will be shared with everyone who is with us today. And SCAN always puts it on the YouTube channel for future viewing. I just wanted to mention that on May 26th is National Senior Health and Fitness Day. So SCAN has partnered with the YMCA of Monmouth and Ocean County for a full day of in-person and virtual classes from 10 to 4. So it's on May 26th. And you can go to SCAN's website and register. There's a flyer on our homepage and you can register there to attend the event. So again, I thank everyone for joining us today. I hope you go out and enjoy this beautiful weather, go out and get a nice walk in, enjoy the sunshine. And again, have a great afternoon. And I think Andrea is going to put up our curtain slide with everyone's contact information in case they want to follow up. Okay, thanks so much, Jennifer. Have a good afternoon, everyone.
You as well. Thank you for having me.